This week, it's National Infertility Awareness Week. It's a struggle that affects a staggering number of Americans, and that number just continues to grow.
ABC's Chief Medical Correspondent Dr. Ashton is here to talk us through this. Infertility hits almost everyone.
Yeah.
And it can be so emotionally exhausting and gut-wrenching for those who are going through it.
I think part of the reason, think about this, most people go through their entire adult lives trying not to conceive, and then when they make the decision that they want to conceive, it is not always so simple. That is the medical and scientific and public health reality. And then that social stigma gets wrapped in. Somehow people feel like a failure, which of course they should not. And we're seeing the infertility rates going up all over the country and all over the world. We're not sure why, probably a number of factors, but as you said, it's a physical, it's a psychological, it's an emotional, it's a social, it's a financial. It wraps in so many elements.
And it is all consuming.
That's right.
It's important to let couples know they're not alone. In my personal case, we had a lot of trouble conceiving initially, and they always tell you, you gotta calm down, you gotta relax. I go, I'm very relaxed.
You can't relax.
What are you talking about? And then they say, well, maybe think about egg donation or adoption. You're like, okay, all right. I think in the end, though, as we all know, it's so much harder on a woman, but it also impacts men too.
And thank you for sharing that, David, because we have to remember male factor infertility is 30 to 40% of the time. It can be very isolating for men. It's not just an issue that affects the woman. There's a ripple effect. It can affect her entire, not only her relationship, but her social circle, her professional circle, her friends. And I think the more we can talk about it, the better it is. And I think we need to be in a place where we shift the paradigm from dealing with infertility to being more proactive about our fertility before it gets to that point.
That's a very good point.
I like that.
And I think a lot of people think when they go into it, like IVF, it's going to be the end-all be-all. It took 6 rounds of IVF.
Right.
So it's not always the perfect solution that people are hoping for.
It's not. The technology is amazing. It's, more than 2 decades old, but it is financially out of reach for the majority of people. Insurance and employers just starting to cover it more. And it is not a guarantee, depending on the age of the woman or the situation at hand. Only about 25% of average IVF cycles result in a live birth. So people need to have their expectations based in reality going in, with the understanding that, as we say in OBGYN, it only takes one.
It only
takes one. And there are a lot of paths to parenthood, not just biologic parenthood. There's fostering, there's adoption, there's step-parenting. But obviously, the more we talk about this in Infertility Awareness Week, the better.
That is the thing. And again, as I said before, it's important to know that they have people have gone through this before. There were options. You talk about the infertility shots. I was, sharing with Liz. I remember when we were talking about. My wife said to me, listen, you have to give me the injections, and you got to do it right.
And you said, deer in the headlights.
Why? And then you like, toughen up, because you know what? This is a team effort.
It takes two.
So there's a lot of things going on out there. So.
But it's good to have this conversation, and I hope more people do, and I hope it becomes the norm, because I remember way back when it wasn't talked about all that much.
It's good that we have a week for it, but we should have a whole year for it, too.
Awesome.
Thanks, Jen.
You bet.
Thanks. It's such an important conversation. I really appreciate you having to talk about it right now.